child-free by choice? Well, it's a decision many women are still defending. But what's the purpose behind the pushback? Well, we're back with OBGYNs Dr. Claire Putnam and Evelyn Minaya, along with sterilization advocate Montana. And now I'd like to bring into the conversation clinical psychologist Dr. Shannon Curry to weigh on this hot topic. So Dr. Curry, thank you so much for joining us.
Hi, Dr. Orden. Thanks so much for having me.
Our pleasure. So how is the pressure being placed on women to have children affecting their overall mental health?
Well, it's creating a sense that women can't trust themselves. It's creating a sense that if you make a decision and it doesn't end up being the right decision, your life will be ruined forever. You will never find happiness. Ultimately, what we know is that while there is some regret for tubal ligation procedures, or in general, even women who don't voluntarily have children, we know that their rates of regret are lower, actually, when interviewed than those who have actually had children. So there is definitely an argument to be had for women trusting themselves, trusting what feels right for them at the time.
Gotcha. All right. Dr. Curry, what are some of the most common stigmas you encounter with child-free women?
So the number one stigma, of course, is that women who are child-free are selfish, that they're not giving back, which is ridiculous, obviously. There are so many ways to affect future generations that don't necessarily involve bearing a child.
You see a lot of women. Do many of these women regret getting irreversible procedures done and then ultimately not having children?
We know that some studies have shown that as low as 1% of women regret it. Some studies show that as high as 28% regret it. What seems to be the most significant finding is that it has a lot to do with, first of all, how often women are exposed to those social pressures that cause them to doubt themselves. So the longer they have gone after the procedure and been exposed to baby showers or questions that cause them to doubt, the more likely they are to buy into this thing we call the scarcity effect, a powerful social message that causes us to value something we don't have. However, the rate of regret for women that have undergone these procedures is not nearly as high as the spontaneous endorsement of people who are interviewed who have children who express that they regret that decision or the timing of that decision or the sacrifices that they've had to make.
To you, Dr. Putnam, how do you see it affecting women being told they can't have a sterilization procedure?
They're coming to me pretty upset. And I think that when I talk to them about the fact that I do this procedure and I support them in this option for themselves, I think they feel very relieved. I think having someone actually listen to you, talk to you about the procedure, take time as a physician to talk to somebody about their options, hear about why they're choosing to sterilize themselves, and really then acknowledge what their personal choices and then enact it in a safe way is just very empowering for women.
No, I agree with everybody, what everybody is saying. I think that it should be a choice going through everything. No, I don't think that the message is, oh, do it the way that I do it, or the message is never and should never be, no, like you should have a baby and things like that, shame you into something that you really don't want to do.